this one question by a person, and he says that like his father was like had COVID and was hospitalized for a long time, and now he has discharged. But now I think he has moved into dementia phase and remembering things from the partition from the 1950s and 60s, and when he was in Lahore. So is this an indication of mental health problem, and how, and though he has shown physical improvement, and how can he help, how the family members can be of help to them?
It's a very interesting question. So there is a difference between dementia and delirium. These are two different conditions. So dementia is a process wherein there is a global impairment in terms of not only your memory and thinking, lots of other things as well. What we have seen is many people who are especially so admitted in the ICU setting for COVID, they might go into a bit of confusional state, yeah, for a short term. And it might seem like they are not oriented to the time and place, they are not recognizing their family members. Now, we do not term that as dementia. That is delirium or confusional state. And it often happens when, there is a problem with the physical health, especially so in the elderly. Even something simple as a urinary infection, or now in these cases lung infection or so on, that can bring on this confusional state. Let me tell you, this is reversible. But depending on the person's situation, it might sometimes take few days to weeks or even months. Yeah.
So yeah, ma'am. Hi, this is my father. I'm Sandeep this side. Absolutely right. Actually, he contacted COVID on 1st of May, and you are absolutely right. Before that, he was absolutely only physical problem was there, but otherwise mentally he was quite sound. Just after taking so many heavy medicines, he was hospitalized, but he was not in ICU. But he was given, strong dose of steroids. After that, suddenly his condition deteriorated in the hospital only. Because, what kind of condition is there in the hospital? They were not taking care, and rather like he was forgetting things, and some bored boys physically assaulted him also. Because, he was forgetting things, he was removing that oxygen mask. So, that has entered his head, and he's very much frightened and afraid. That he was absolutely all right mentally.
Yeah. So, Mr. Sandeep, let me clarify a few things.
And you are right. This is a slight phase of confusion. He's a little bit confused. Sometimes he remembers us, okay, mera beta hai. Sometimes he forget everything. Who are you? Even he's forgetting his wife also of last 50 years.
In view of time, we'll not go further because, it can be discussed one-to-one, but you brought up a very important issue here I would like to address, myself being a doctor. So there are few medications. Yes, steroids are really important in COVID and they need to be given. But as I told you, sometimes they can bring about a change in the personality. Now, infection in itself and being in ICU with all those things, again can bring on this confusion. I would not blame it on the medication or the doctors or not the proper care being given, because this is likely to be there due to the condition itself. Yeah, so we cannot say that the steroid was high dose, that's why they got, or this was low dose, or this was not managed. This is a very common situation that can happen. We can call it as ICU psychosis, some people term it that, or delirium or confusional state. And as I'm telling you, it can happen to anyone without any pre-existing mental health conditions. But the good thing is this is reversible. So you definitely still need a psychiatrist to be involved at that point, so they can treat, because there will be some symptomatic treatment that is required, and gradually you will wean off. Dementia is different from delirium, but you would only reach to that stage, say a few months down the line, then you will again have, after regular follow-ups, you will have proper follow-up again to check, hopefully, that the delirium is not developing into some other mental health issues. But most of the times it is reversible and people come back to their own personality.